So let's see what is the RISE protocol in the fracture management. First, we can consider general fracture management, and management of the fracture can be considered in three phases. Phase 1 is emergency care, phase 2 is definitive care, and phase 3 is rehabilitation. Here we are going to discuss about the phase 1 emergency care. Emergency management of a fracture involves controlling bleeding, immobilizing the injured area, applying an ice pack, elevating the limb, also calling the emergency medical help. RISE. So RISE means first is rest to part by splinting and ice therapy, compression, elevation to reduce the swelling. This is the RISE protocol. R in RISE stand for the rest. Rest the injured area for 48 hours. Rest helps preventing further injury as well as speeds up the tissue healing. If you don't rest, ongoing movement and weight bearing might aggravate your injury, increasing the inflammation and swelling. Rest to part is done by splinting. Splint them where they lie. Splinting advantages are relief of pain by preventing movement at the fracture, prevention of further damage to skin, soft tissue, and the neurovascular bundle of the injured side, prevention of the complications such as the fat embolism and the hypovolemic shock. Also, transportation of the patient will be more easier. The next is the ice therapy. An immediate application of the ice to injured part helps in reducing pain and swelling. It's most effective in the first few hours after the injury. And ice for 20 minutes at a time, 4 to 8 times per a day is advisable. Use a cold gel pack or a plastic bag filled with ice, but don't place it directly on your skin. Wrap it in a towel first. After you remove the ice pack, give your skin time enough to get warm before icing it again. The next is compression. Compressing an injured ankle, knee, or wrist helps reduce swelling. Elastic or crepe bandages like a scrap are effective. Special boots, air cast, splints also provide compression and support. Compression is to help reduce swelling. Don't wrap a compression bandage too tightly as it can restrict the blood flow. If you feel throbbing, loosen the bandage and reapply it more gently. Next is elevation. Elevate the injured part of the body above the level of heart. This provides a downward path for draining the fluid back to heart, which reduces swelling and pain. Try to elevate the entire limb 6 to 10 inches above the heart. And this is RISE. Rest, ice pack, compression and elevation.